Hi, Abby.
Hi, Beta. How are you?
How are you?
I'm cold in my house. I don't know why. I got so cold. I put on my jacket and I put on a scarf.
I'm going to add interpreters right now. Interpreters. English and Spanish. Add another interpreter.
So while you're doing that, Luciana wanted me to remind you and Julissa when she's on to just make sure that we all speak slowly because of the interpreters. But I'll mention it when I introduce you all.
Okay. Why do I have two interpreters? Ah, yes, I remember now.
Okay. I'm like, I don't know.
Yeah, one is to monitor and one is to translate, to interpret, I think. I think that's right.
Okay.
Yeah, that's right.
Okay.
Thank you.
Yeah, you know, I don't speak slow. I want to try my best.
I know. I also don't speak slow, especially when I get a little nervous.
Yes, exactly. I was practicing and practicing, and I think I'm gonna go over 15 minutes.
Julissa, I think, is gonna go over too, but you know what? All we can do is the best that we can do.
Yeah.
We can just try our best. How are you otherwise?
I'm good. Busy as hell. You cannot imagine. Like, oh my God, so many things to do. I'm recording, by the way, because I'm gonna forget to record it if I don't record right now.
Okay. You're gonna hear me say that you're gonna be recording, but no, I feel really like very busy, and also that I'm like not keeping up. So I feel like I'm dropping some balls.
Yeah.
And I'm actually gonna try to start going to the office.
Really?
I think like it's part of it is that working from home, there's no clear demarcation.
I got used to it already. I really like working from home now. Yeah.
I'm the opposite. I got used to it pretty quickly. And now I'm like, okay, I need a little bit of a hybrid.
Yeah, in fact, hybrid is fine. I think once or twice
Hybrid
a week
is
or
like-
every.
Yeah.
But I
Hybrid.
don't want to be there every day because I realize that I spend a long time traveling in the commuting. If
Oh, yeah.
yeah,
Yeah.
Julissa.
Hi, Julissa. I'm Gabriela. I'm going to be your moderator for today. And I was just, hopefully you can hear me, but like, I was just telling Luis that for all of us to be mindful to speak, especially if you're a fast talker, like I am at times, and Luis at times, slowly, because we are going to have interpretation services available.
So you were told, Gabriela, that when you inform people about interpretation, you are doing it in Spanish, right?
Yes, and luckily, Luciano sent me the text because I was like, I know I will get nervous, and so when I start to say it in Spanish, I'm gonna be like, tenemos interpretación disponible y mira abajo y you know. So he sent me the information. He said, hola a todos, todas y todes. Para aquellas personas que desean escuchar esta presentación en español, tenemos disponible el servicio de interpretación. Para activarlo, selecciona el botón de interpretación en la barra del menú de Zoom y selecciona español. Muchas gracias. And then the interpretation is activated.
It's activated already.
And then I introduce the topic.
Yeah.
Excelente. Muy bien dicho.
Oh, Julissa, me dijo Luciano que querías broadcast a video or something like that. You want to make sure that it works?
Sí. So I understand that I will be, I can monitor, I'll share my screen.
Yes.
Okay.
Can you do it now so we can?
That's why we got on. So here. Okay. Do you see that?
I see, yeah, but I don't see the video.
No.
Yeah. But I think you want to show the other screen, like when we don't see them.
Do you see this video?
No. You're showing the other screen. There's like, when I'm in the office, I have two monitors.
Yep.
And you have one that what I'm watching right now, what I'm seeing right now, and the other one, which is the presentation itself. Here at home, I don't have a problem, but I notice that many people do this, and it's the other screen.
Yeah. So when you're sharing your screen.
Do you see it now?
No, we see what you're sharing, but we don't see the presentation. We see it's the presentation, but your version with your notes and everything.
Uh-huh.
So this is, I think what I have experienced is that, so you're sharing your screen, which is the slides.
Yeah.
When you click on the YouTube link, that actually doesn't automatically open.
Right.
So you have to stop what you're sharing and then start resharing the actual video page. Does
right.
That
okay.
Yeah.
Okay. Right now, when you are in this screen, can you click like to make it the slideshow? Yeah.
Yeah.
I don't know why it happens like that. When I share, it doesn't look like.
Do you see what do you see now? The second slide. ¿Saben cómo vamos a vencer por completo? You see that slide?
Yo veo eso y veo también el next slides.
Oh, but you don't see the full PowerPoint presentation? You just see multiple slides?
Yeah, I see two slides right now.
Oh.
What you want to share and the next slide. Do you see that, Gabriela?
Yeah, what you have to do is, so you click on advanced sharing and then you'll see something that says portion of the screen, and you can highlight that the part that you want seen in green. So you'll still be able to see your notes, but the viewer won't.
Yeah, the notes are fine. I took out the notes. I mean, okay.
Or the next slide, they won't see that. You have to choose presenter view though. In advanced share and click on the, so let me,
A portion of the screen. So under advanced, I use portion of screen.
right. And then when you pull up when you're sharing the slide deck, just make sure that on PowerPoint, you click presenter view. Right.
Like this, right?
Yep.
Okay, let me try, if I may.
Go ahead.
Advance.
Right. So now all we see on our end is your slides. We don't
But
see.
it's huge.
slides.
I don't see the entire slide. Do you see the entire slide, Gabriela?
Oh, no. Now I'm seeing a portion. You may
Yeah.
have to minimize that little green window. Do you see the green window or the?
Yeah, I see it.
Just minimize it so that all we're seeing is like, we're seeing the whole slide deck. There you go.
Yeah, there you go.
Got it. So you see that?
Yeah.
What do you see now? You see the YouTube?
Yeah. So
See
click.
the link.
Yeah.
Do you see the discuss slide?
Yes.
Perfect. Okay.
Yeah.
Now I know.
Isn't it so much fun?
Static. You learn something every day.
I know, right?
What is this?
All the Zoom
Oh.
fun.
Okay. It starts in 5 minutes. So I need to, before letting people in, I need to start sharing in Facebook. It's already recording. The interpreters are already activated. If anything else I need to do, no. Yeah, so.
Julissa, you're not able to hear us?
See? Why?
I just saw unable to hear in the chat.
Julissa, do you hear us? No, we can. She muted.
You're on mute.
Julissa. No, she's not muted.
Or maybe she has her sound down. We were just hearing her.
Yeah. Do you hear me well? Should I wear the headphones?
I hear you.
Okay.
I think is she still here? Oh yeah, she's still here. All right, but Beto, you'll let me know then when I can start speaking, right?
Yeah, I will. I mean, you will know because I will. When I start and you will see people coming into, just give it like 1 minute so people get into the
Audio.
Oh yeah, now we hear you.
There we go.
Yeah.
Okay, we figured it out. Thank you.
Okay. 3 minutes still.
I should close my door so that my cat doesn't come in and start causing a ruckus in the middle of this.
Um, okay, I'm gonna start going live right now. More live on Facebook. Page, go live. I think we're live now.
Yes, we are live.
Okay.
So good afternoon, everyone.
No, not yet, not yet, not yet.
Oh, no? Okay.
Now. No, okay. The road's coming in now.
We're just going to give one more minute to get everyone, as everyone starts joining us today. Good afternoon, everyone. I would like to inform you all that we have interpretation services available in Spanish. Hola a todos, todas y todes. Para aquellas personas que desean escuchar esta presentación en español, tenemos disponible el servicio de interpretación. Para activarlo, selecciona el botón de interpretación en la barra del menú de Zoom y selecciona Español. Para las personas que están llamando a través del móvil, tienen que pulsar el botón para más y después escoger interpretación de idiomas y seguir las mismas instrucciones que antes. So hello everyone and welcome again. I am Gabriela Betancourt and I use she, her, ella as my pronouns. I will be your moderator for our session. And today we will be discussing how we can ensure that our communities, Latinx, people of color, and LGBTQ+, have equal access to the COVID-19 vaccines. We will discuss messaging, what is the message, and how we can bring it best to our communities. I invite all of our attendees to drop questions in the Q&A function on Zoom or in chat. We will have a question and answer period at the end of the session. And just to ask everyone that in keeping with language justice principles and for our interpreters, we ask that everyone speak slowly and clearly and in one language at a time. And with that, I'd like to introduce our two speakers for today. Julissa Gutierrez is the Chief Diversity Officer at New York State, Office of Governor Andrew M. Cuomo. And Luis A. Mares, Licensed and Masters of Social Work, is the Director of Community Mobilization Programs at the Latino Commission on AIDS. I'm going to invite Luis to start off with the first presentation. Thank you so much, Luis.
Gracias. Thank you, Gabriela. Let me start sharing. Okay. Thank you very much, Gabriela, by the introduction. As Gabriela said, my name is Luis Mares, and I work at the Latino Commission on AIDS, and I am the Director of Community Mobilization. And as such, I am in charge of organizing and implementing our two main awareness campaigns every year, the National Latinx AIDS Awareness Day that happens in October 15, and the National Hispanic Hepatitis Awareness Day that is happening right now, and the central day is May 15. So just a little bit about the Commission. The Commission is a nonprofit organization that was founded in 1990. So we have over 30 years working hard, in trying to improve the health of the Latino community. We are focused on HIV and AIDS, hepatitis, but we also focus on health disparities, all types of health disparities in Hispanic and Latinx community, and therefore COVID-19 is important for us as well. We have a diverse set of programs at different levels, local, regional, and national, and we don't work alone. We usually have working coalitions and partnerships with different organizations around the country. And even though we are based in New York City, we have offices in the south of the country, in North Carolina, and we have hubs in Florida, Louisiana, and Georgia. So when COVID-19 pandemic happened and data showed that the Hispanics and Latinx were more affected, it became our duty and our main preoccupations during 2020 and 2021 to inform our communities with actual and current information about the prevention at that time and now more about vaccination. We provided messages about masking, social distancing, and now we are providing messages about the safe and the effectiveness of the vaccines. Understanding that the importance that true information meant for our society in moments that we were provided with false and misguided information coming from previous administration. We saw here in New York and in the entire country, basically, how COVID-19 devastated the health of our society and the entire country. We saw how the hospitals and the health system were not enough, the number of cases of COVID-19 that were happening. We saw many people dying. Here in New York, we saw bodies in frigorific trucks. We saw once more that the pandemic also is affecting the poor, the minorities, the working class, and communities of color, as the Hispanics, in a very disproportionate way. Data show that Latinos were 30% more likely to get infected and about 3 times as likely to die of COVID-19. We also know that Latinos represent almost 30% of all cases of COVID-19, second only to whites that represents about 50%. But as we can see in the slide here, we Latinos represent only 18.5% of the entire population of the country. Data also show that positivity rate among Latinos is 30%. Of 100%, or 10 Latinos, 3 came out positive for COVID-19. In 2020, data also showed that the overall death rate among Latinos was 53 higher than previous years, while it was only 33% higher in Blacks and 12% among whites. So these numbers show how COVID-19 became another health disparity for us, the Latinx community. And the reasons for this to happen, they were discussed and touched yesterday in the open plenary by Dr. Rebolledo, so I'm going to repeat something that we already heard. Latinos work in frontline jobs, and most were not able to switch to remote work, and these put people at higher risk. At work, they didn't have basic protections, and to get to work, they didn't have the access to private mobilization, private transportation, and they had to take buses and trains, and there they are exposed again at a higher risk to get infected with COVID-19. Latinos also have higher risk, higher rates of poverty, and more than likely live in crowded homes. 27% of Latinos live in multi-generational homes, is a higher percentage than whites, who only represent 16% in their cases. Latinos also have less likely to be connected to healthcare. and have medical insurance. And as a consequence of all these, Latinos also have a higher rate of chronic conditions like obesity, hypertension, and diabetes, which place people at a higher risk of complications for COVID-19. Therefore, the burden of COVID-19 in our community, in the Latinx community, makes vaccination in our community a very more urgent topic case. But once vaccinations rollout happened, we witnessed the same disparity. No, Latinos were not receiving the vaccines at the needed rate. Earlier reports of CDC and until now show that from all the people that are vaccinated, only 12% are or were Latinos, far below the 18.5% that we represent in the country, and even more below the 30% that we represent among all people living affected by COVID-19. And that number could be even lower since the data collected is not complete. Even though data collected for age and gender is almost 100%, data collected for ethnicity and race is not complete. It's only 61% of the data collected data from vaccination centers report ethnicity and race. So it is mentioned that one of the reasons for this disparity, these numbers on vaccinations among Latinos, is caused by vaccine hesitancy, which translates that many Latinos do not trust the health system, and also because Latinos worry about sharing their personal information. And despite the fact that vaccines are free, many Latinos worry about the cost of it. Others have unfounded but widely accepted misbelief about vaccine risks and vaccine safety. But for millions of Latinos, the problem is not hesitancy, it's access. Vaccine delivery in many places of our country are structured and designated for people who have computers, for people who have smartphones, for people who speak English and who have access to transportation and flexible schedules and do not work from home, and who do not live here in fear to being arrested and deported. So in order to engage Latinos into vaccination, we must do a lot of things. We must go to where the need is. We must go to the communities where Latinos live. And we need to advocate and raise our voices so the health authorities make changes in the distribution of the vaccines, creating vaccination centers that are more accessible to Latinos in areas where Latinos live and work. Not only that, but also that the centers should be open at different hours, like the usual, because Latinos work and they do not have flexible hours of work, so they cannot go before finishing their labor hours. So these centers should be open after working times, after office hours, during the night, even 24 hours if possible. And we as organizations that work with our communities have to adjust our approach accordingly, bring information and promoting vaccination in a more cultural and linguistically appropriate ways, with messages that are easy to understand, explaining the importance of vaccination and explaining about the safety and efficacy of the vaccines. We need to bring the message through channels that are trusted by the community, religious leaders, people that work in education, priests, pastors, teachers, their own physicians, no? Los médicos de cabecera, members of the community, and organizations that work with the communities and are trusted by them. And building trust is very important. Building trust is one of the most important parts of this campaign that we are developing, trying to deliver messages about vaccination to the community. And we have to include the community also. Without doing this, it is going to be very difficult to reach the community, the Latino community, with messages with vaccination. So we also heard that vaccination is limited. It's not enough to reaching Latinos, and the Latinos do not have access to vaccines like other communities. Whether this is true or not, but it is true, we have to make sure that Latinos have a better accessibility, as I mentioned before, to vaccines, and that they are ready to accept it, that they are informed accordingly to be able to accept the vaccines to prevent getting sick from COVID-19. For this, we need to create awareness in our community. We need to provide education and verified true information about the vaccines. Now, as I mentioned in the previous slide, we need to involve many stakeholders in this process. Organizations like us, or partners, to create awareness campaigns, partnerships among different organizations, CBOs, health departments, religious organizations, educational institutions, universities, We need to involve the Spanish language media as well, regular media like TV and radio, like Telemundo, Univision, need to be participate in these campaigns, delivering information. They are the mass distributors of information among Latinos. Also doctors, nurses, and primary care physicians. The service has demonstrated that Latinos trust their doctors. The Latinos want to get vaccinated by the doctors or at least at the same center where they receive their medical care. And if possible, we should include Latino celebrities and civic figures, and they should share their experience with vaccination and the experience with COVID-19 and prevention and everything around COVID-19. And we all need to get involved, sharing our own information in our own social media platforms. And so our families, our neighbors, our friends who are still hesitant about getting vaccinated understand and know by firsthand, for people they know closely, about what happened when we get vaccinated, our own experience, and share what we felt and how long we felt it, and that we are okay, that it is working. But also we need to ask for the federal government or the state government or the local government health equity. No, and this is not just for COVID-19, but for every epidemic that affects our country. We need to reach health equity, making sure that all Americans have access to medical care, medical insurance. And in this case of COVID-19, health equity goes beyond, and it should be like all the communities that are affected most by COVID-19 need to have more access to care and prevention with vaccines. No, and we also need to, in respect to Latinx community, we need policies and programs that address the realities of our community. We are most of the time treated as a monolithic group, which is not true. We are all different. We come from different countries, different cultures. We have different customs, different foods. We put us at different risk for different diseases. And it's also a difference between the people, Latinos who were born here in the country and Latinos who were born outside the country. And we have different experiences through immigration, social class, education, poverty, labor, etc. So we have to make messages in a general way for all the community, but taking into account that we are not all the same as they tried us to be. No, and so this should be a language justice across the nation. As I mentioned before, the areas that need to be targeted mostly by this type of messages are the areas where Latino lives. No, we know in every city and every town, and also we need to address rural areas where most of the times messages don't reach. And we had to make, obviously, messages in languages that are spoken by our community, not only Spanish, but Portuguese and native languages like Quechua, Aymara, and other languages that are spoken in Central and South America. The Commission from the very beginning of this pandemic is strategizing and adapting its functioning to continue providing services to the community and to address this new problem that we are confronting. For this, we implemented internal and external measures. Internally, the Commission immediately implemented protocols to make sure that staff and the clients were safe. No? And immediately also, we started to provide services via telehealth, such as counseling and patient navigation. And we also implemented home self-testing for HIV and hepatitis. We also continue monitoring the pandemic at local and national levels so we can adhere and follow the directive of the CDC and the health authorities. And we were able to pass this information to our community, our clients. Externally, we work together with other organizations. We created partnerships. We engage community through networks and leadership at the local, regional, and national level. We deliver information, and we wanted to create awareness. As I think was mentioned yesterday, also in the plenary, partnerships became very important in this effort that we all are making to engage the community. Alone, we cannot make it. We had to make partnerships with communities that are trusted by organizations that are trusted by our community. So the Commission engaged in the work of creating awareness campaigns. There is Tu Salud Cuenta, national campaign that the Commission is about to launch maybe in the next week or in the next 2 weeks. We also have the Latino Religious Leadership Program that immediately started to provide information to the communities of faith so they can deliver the information as well to their congregations. Poder en Salud is a program that the Commission is doing in coalition with Proceed, and so they deliver community forums in Spanish where the community can ask to experts directly about the doubts that they have about vaccines. And Pandemia, which is a series of webinars that are organized in collaboration with the COVID-19 Prevention Network. And this is the one that I was mostly involved, but you can see behind there. This Pandemia is a series of webinars that the Latino Commission and AIDS delivered through a partnership, a collaboration with the COVID-19 Prevention Network, a network of institutions and researchers that seek for safe and effective vaccines against COVID-19. Many of the members of this network have participated directly in the studies and trials for the vaccine researchers in different parts of the country. So our relationship with this network started at the very beginning of the pandemic, and we were able to deliver 2 initial webinars in July and August in English and Spanish, where we were providing information, clear information about the studies in phase 3. Not only because we wanted Latinos to be part of the studies, because it's important that our community is represented within the group of people that are participating in the studies, but also because we wanted the community to have a better understanding of how this happens and trust science, increase the trust in science. So we continue, we saw that these webinars were very successful. We had a very high number of registration and participation, and we saw how the community was very interested in learning more about this. We continued the partnership and created this Pandemia series of webinar. Pandemia is pandemic in Spanish. We wanted to make it like that so people know what we're talking about, Pandemia del COVID-19. And we deliver 1 webinar every month with updated information on vaccines. Well, as we know, things have been changing constantly since the rollout of vaccination. All the vaccines came out at the beginning was only Pfizer, then we have Moderna, then we Johnson & Johnson, then we stopped Johnson & Johnson, and we're starting again. So all the things and all these questions that are generated by what we are seeing happening in our daily living, daily life with the pandemic are asked by the community directly to people who work in the area. So we have, we wanted in this pandemic series, to bring professionals, Latinos, from different areas, doctors, public health professionals, social workers, and community leaders, that they can share their experience and their knowledge about pandemia to our community. So we also wanted to be diverse, and we have presenters from different countries, not only the USA, Puerto Rico, Dominican Republic, Mexico, El Salvador, Ecuador, Peru, Chile, and Paraguay. I mean, we wanted to bring people from more countries if we can, and we're going to continue doing this. We make webinars in English and in Spanish, and sometimes we allow people to speak in Spanish and we just translate it, and most of people, all the people that participated are bilingual. And we continue delivering these webinars. We realize that this is very important to bring actual information, current information to our community about what is happening in a way that they understand. So summarizing, in order to engage our community in COVID-19 vaccination, we need to work in partnerships with different organizations, scientific institutions, medical providers, government officials, community-based organizations, and community health. We need to listen to the community and take the suggestions. This has to be a combined effort and a bi-directional dialogue, hearing the voice of the community. We needed and still need to bring accurate information to the community in cultural and linguistically appropriate ways, especially when the misinformation about COVID-19 was so abundant and coming from places like the White House in the previous administration. We need to make sure that our community knows that vaccines are safe, secure, and effective, that they are free, and that there is no risk of being arrested or deported, and that their process of citizenship or naturalization is not going to be affected. We need to share stories from people who have been vaccinated, public leaders, famous people, Latino celebrities, and all of us about vaccination and why it's important. Why are we doing this? Why we need to reach herd immunity, and so we can be able to go back to our regular life, or a new regular life, going back to work. Jobs needs to be revamped. Jobs need to come back. Many people lost their jobs to the pandemic. They need to go back to work, and it's not going to happen until the situation gets better. So we can also see our family, be able to hug each other, see or be able to travel, and in general to live again like we used to. So that's it. Thank you very much.
Thank you so much, Luis, for your presentation. It's very informative and useful. It gives us takeaway considerations that can really be applied to action and to practice. I would like to once again welcome Julissa Gutierrez and turn it over to her.
Thank you so much, Gabriela and Luis. Allow me to share my screen so that we can get started. And give me 1 second. Great. There, do you see the slides up?
Yes.
Excellent. So, buenas tardes, good afternoon. Like has been mentioned, my name is Julissa Gutierrez. I'm the Chief Diversity Officer for Governor Cuomo for New York State, and it's a pleasure and honor to be here with you all with Latino Commission on AIDS during this pandemia series. I want to thank, of course, Luis, Luciano and Luis as well, and Gabriela and the whole team, especially Guillermo Chacon, who is a dear friend and also on the subjects of vaccine equity, sits on the Vaccine Equity Task Force that the governor convened and is an integral component to the advocacy across the state for Latinos and all BIPOC individuals. So I want to kick off. I was really interested in this topic, of course, working alongside with the Department of Health, ensuring that we're rolling out the best possible program along with the many partners that are necessary. It's an all hands on deck initiative. So I wanted to focus on vaccine messaging and demand. Clearly the way that Luis has just undid his presentation, talking about the fluidity that is needed in messaging to reach our communities, as well as the need to create a generation of demand, given the game changers that we're currently facing in the last couple of weeks. So I want to kick off this presentation with sharing a public service announcement that we recently have kicked off for the energy that you can feel for the campaign and the moment at the moment.
Y la gran noticia es que en el estado de Nueva York ya todos podemos. Si tienes 16 años o más, haz una cita hoy mismo. Las vacunas son seguras, eficaces y gratuitas. Regresa a las cosas y las personas que amas. Protege y protege a tu familia y a tu comunidad. Sé tú al estilo Nueva York. Vacúnate hoy mismo.
Excellent. So I wanted to start off with that.
Why is the shot of olive oil the
share with
perfect way
you?
to ring in the new year?
Okay.
Good tip.
Apologies. Okay. Thank you. So I want to start off with that just to show that we are in a need, in a state to scream off the rooftops of everywhere that todos están elegibles, mayor parte de los que son mayores de la edad de que estamos haciendo ahorita, that we are, ensuring and messaging to the community in different languages, particularly in Spanish, to make sure that they go out and they get vaccinated. So I want to kind of just do a quick summary of New York State's efforts to date. Talk a little bit about that supply and demand and how it's inverted itself, as you all know. Looking forward to some messaging based on some recent polls and anecdotal information, as well as some ideas for looking forward and to collaborate on. So as mentioned, COVID-19 has been an unprecedented game changer for all of us across the world. And the health disparities it has highlighted have existed all along. So the bar is really high. We understand and know that the communities that have traditionally been underserved by the healthcare system have been the one hardest hit by COVID. And from the start, the governor and the state, the Department of Health, just had one goal in mind to ensure that we have equity across the board in this vaccine rollout. And that goal was to get as many shots into arms as quickly as possible. And so we started off last year kind of with the foresight of what was to come. And thankfully, we placed the proper measures to ensure that one, that there was clinical advisement from state experts as well and health department officials with the clinical task force advisory council, for example. We also set up the vaccine equity task force that I've mentioned before, where we have over 200 community leaders that are helping to advise and as well as participating in regional health equity hub conversations across the state. And so the vaccine equity task force has truly been integral to informing the state's efforts. And as of today, we have over 15.7 million vaccines that have been administered across the state. Close to 50% of New Yorkers have been partially vaccinated, and over 35.7, meaning more than 1 in 3 are fully vaccinated. And we have been able to ensure that we're doing some targeted messaging and vaccine rollout by going through a zip code level analysis. As you know, at the start of it all, we wanted to make sure that we were getting to the communities most burdened by the pandemic. For example, one of them being the Bronx, for example, New York City was the hardest hit borough. And so we quickly were able to do a partnership with Yankee Stadium, which I'll talk about in a minute, but also using the Federal Social Vulnerability Index, as well as ensuring that employers know and employees know that they have their rights to go and access the vaccine. So making sure that there's different angles that we as a state are able to facilitate, as well as dispel disinformation, address vaccine hesitancy, reduce barriers to vaccinations, and again, ensure the equitable distribution. So as I mentioned, we continue running 31 state-run vaccination sites across the state. We have done special efforts to ensure that we are linking up with culturally competent and relevant providers, which is critical to what has been said already, is connecting our communities with providers that understand, are from the community. So through direct partnerships with houses of worship, public housing, and community centers, we have been partnering, for example, with partners like Somos Community Cares that has staff that's culturally relevant, that's able to work, with staff and go out to, for example, to NYCHA, New York City's public housing authorities, and work with their housing for the aging, work with other community centers. Most recently, we put together some pop-ups for walk-ins for New York City bodega, grocery store, and supermarket workers, for example, which is key to ensure that frontline workers, essential workers are out there and have easy access. And we're working also with the employers. And so making sure we're working with the National Supermarket Association, along with the Yemenese American Merchant Association. So constituencies that have a lot of folks of color. And so those are like the strategic partnerships that we are looking at and working towards. Another partnership that's really important and must be shared and talked about are the incredible job that federally qualified health centers are doing and the local health departments to bring additional pop-up vaccination sites. And we've also worked with them most recently with agricultural workers and food production workers, for example. So Migrant Sun River Health Center is a federally qualified health center for migrant workers. And so it's key to be working with these FQHCs that are working with underserved communities, offering primary care services, and who can already have these relationships. And as a state, we're able to add or supplement the vaccine that they may have, and work with them and coordinate efforts on the ground. And like I said, we have, in addition to that, we are working across the board with different counties. For example, in the village of Mount Kisco, we were able to work with Northwell and other community nonprofits like Neighbors Link, and work with their senior department and all their senior centers to ensure that we're getting the vaccines to Latinos in that community. And so it's really about, like has been mentioned, forming those local state partnerships to ensure that we're able to bring the vaccines. And again, these are some examples that, since things have changed so quickly the last couple of weeks, that that I wanted to highlight to see how we have rolled out the program. And something really important to note is that many of these sites that we've done across the state in the last couple of months have been informed by the community, including the Vaccine Equity Task Force members, who have stepped up to the plate and said, yes, my church or my community center or my federally qualified health center is available and ready to administer the vaccine, and with a partnership, we can move forward. As mentioned, we launched back in February a massive vaccination site at Yankee Stadium, which has proved to be really helpful. We wanted to ensure that we were in the Bronx and available since there was concerning positivity rates, which is the highest again in all of the New York City boroughs. So just mentioning and the importance of these partnerships. And here, I kind of wanted just to kind of illustrate or mention, this is a New York Times recent graph that I saw that kind of, I think, spoke really well on our supply and demand pandemic as well, or paradigm that we're currently facing. And so we always knew that the supply and demand curve would invert suddenly. And that is exactly what has happened. As you can see, the different vaccines out there and throughout the ages of groups, how they have, at one point there was a peak, of course, for the most elderly, and then how it's flat, how it has dipped, etc. But knowing this ahead of time, in response, we in New York State, we made it so that anyone now can walk in and get at any New York State operated vaccination site is available to get their vaccine. We are advertising this, as you saw through the PSA that I showed. We're advertising universal eligibility, for example, and walk-in accommodations across all media. So TV, print, and digital. And as we enter this new phase, as I mentioned, the biggest concern now is that demand generation, which is our main focus. And so how do we, I first want to, before we get to the demand generation, I kind of just wanted to walk us through, our eligibility expansion and how it was a story of increased access. So in the beginning, starting end of January, February, we all knew that, supply was limited. What many other countries in the world are facing now, we were going through earlier. And so because of supply that was limited, so too was eligibility. And so we started to prioritize based on certain ages. We first went from 75 and above, and then we moved down to 60, and then we went down a little bit more. And currently right now, obviously we have eligibility for those over 18 who are eligible. And we also made sure that we were expanding to reach underserved groups that, had a lot of public facing interaction. For example, grocery store workers, those who are working in convenience stores, the bodegas, the regional food banks, the food pantries, and delivering homes to, to those homebound. Many of these are essential workers, like I've mentioned, and again, serving as public-facing government or public employees or not-for-profit employees that are really on the front lines. And so we were able to also provide them access when we were working through a worker classification as well. And now, we're looking at, what's next. We're waiting on news, as we heard just this week, for the expanded emergency use authorization that Pfizer is set ready for children 12 through 15, since now we can do 16 and up for Pfizer. So those are some things that, again, are going to continue to impact all communities, and want to be mindful that folks are attuned to that. So in terms of, some of the messaging that was addressed before in the first part of the presentation, it is important that we are building that trust. And one way is that we have to be upfront with some of the fears, and either, these are fears that are historical fears, these are newfound fears based on different population and times in this country. But one thing that we know in our community, in the Latino community, is a fear of government, a fear of police, a fear of ICE. And so one of the things that we had to make sure that the governor hedged on early on was ensuring that no personal information would be given to the federal government that can be used to identify someone's immigration status. So that had to be early on. As you can see, this was done in December 9th, and a lot of conversations with the White House, along with making sure that we're communicating this to the community. So making sure that we're allaying the fears that some folks who have, don't have, legal status may be fearful of getting the vaccine. Other things to keep in mind that I think that are helpful, and as you may have this thought, is that at some of our mass vaccination sites, of course, it's all hands on deck. We want to make sure that we're using as many resources. And one of those are our National Guard personnel. And although sometimes, for some, it might be a welcoming experience and having them greet you, et cetera. For some individuals, that might not be a welcoming sight, and that might be something that, folks might be fearful of. And so we want to make sure that, again, we're providing options. And so those alternatives are working with partners like Somos Community Care, where, such presence of a National Guard is not needed. It's a pop-up, it's a smaller operation. And so those are just some things that, you're trying to create options for folks that so that they can feel comfortable going and accessing. A little bit more on how the COVID Vaccine Equity Task Force has been instrumental in getting the message out there. The task force has been able to develop some multilingual resources that have been distributed to all the task force members, which then gets trickled down to their communities and their constituencies and members, and that we're all kind of on the same page of information. In addition to that, using these trusted voices of community influencers, like Frankie Miranda, who is a friend of all through the Hispanic Federation, and making sure that, again, we are highlighting our partners in this endeavor. It's better for someone to hear it from perhaps the governor versus a Frankie Miranda, who they feel probably, because he's speaking Spanish fluently, it might resonate with them more, or because they are Puerto Rican, might resonate with another Puerto Rican speaking to them about vaccine confidence. So it's really about how do you localize some of those messages and the talent behind it. One other thing that we did that I think has been instrumental to kind of from the start in increasing vaccine confidence and dispelling a lot of misinformation and disinformation is holding fireside chats, charlas, having cafecitos. And these are really conversations that everyone's having nowadays. At the start, they were much more organized. We did put together a toolkit. So we did over 10 sessions, reaching over 6,000 New Yorkers. We did an in-language one in Spanish, which was amazing, with 3 Latina medical professionals who answered great questions and had, their own insights. And so the Fireside Chat Toolkit, and it's been translated in Spanish as well. You can find that, and it's available at newyork.gov/VETF. wanted to make sure that, because a lot of those questions there are conversation starters, you know, and a lot of information is already out there where folks can find out, you know, is the vaccine safe? You know, what were the clinical trials? All that information is there. It's just a matter of having these conversations in our communities. And so we're hoping that we can provide that through the toolkit. And, you know, like I've mentioned, you know, beyond the toolkit for the fireside chats that's available in Spanish and other languages, you know, wanted to also highlight the current messaging that we have in the messaging outlets, where, you know, speaking to the point that Luis mentioned, you know, how language accessibility is justice. I believe something along those lines. And I truly believe language access is really, you know, an influencer, a determinant of folks reaching, and for us to ensure that, you know, we get that to that herd immunity. Our community needs to understand, needs to be informed, educated, and empowered. And how do you do that? Is by having all these messaging channels available. So we have them online, and we also have them at vaccination sites. And, you know, we have the call center, an online scheduler, for example. You know, we've done events with different Latinx, Hispanic community leaders, extensive digital and TV advertising in Spanish, up to like the 7 digits. You know, and these are items that we have, for example, the MI eligible screening website. Even though individuals are now available to do walk-ins at all the state vaccination sites, you know, maybe they still want to go through the MI eligible screening website, just to kind of make sure that, you know, there's no questions, or if they have any questions, who to contact. You know, we also have, you know, for all our mobile vaccination sites, we are getting audio translation devices and services available for those who are non-English language speakers, for example. So, you know, I think at the end of the day, for us, it's important that we're addressing as much as we can through these outlets. And one of them, obviously, is that the vaccine is free, and which is one of the top rated reasons to receive, you know, to receive the vaccine. So we need to continue to hammer that message along, that it continues to be safe and effective, especially that it's, you know, highly effective at preventing serious illness and death from COVID-19. So I wanted to highlight, you know, we recently did a survey just recently last month. I can't believe it's already May, but we wanted to understand a little bit more some of the challenges and opportunities that lie within reaching our communities. Again, the Hispanic and Latinx community. And I think the upside of it, the story that tells us, is that Latinos are, about 20% of those that were surveyed Latinos seem to be hesitant. But they're considered to be soft hesitant, which means that there is opportunity to persuade them, right? And so, and actually much less hesitant than other population segments, like millennials, Gen X women, lower income white, for example, or our African-American brothers and sisters. So I think that that's important to note, and something that we can all work towards, to know that, and I kind of also see it within my own family. I think that a lot of my own personal family and friends who I've done informal polls through WhatsApp or through other conversations, has been, some of them, and not to my surprise, have taken more of a wait and see approach. And so I think that speaks a little bit to that soft hesitancy that we found here. And so again, one of the areas to focus on for all at the moment is to making sure that access is not a problem, you know. And so again, from our, you know, what we understand, those who are not hesitant and know that they are eligible, even though they did not make an appointment, it suggests that there are still, you know, opportunities to increase our efforts to get them to that point where they are. So we've done the low hanging fruit, and we still have a few more to go, but we just need to bring it, the vaccine, to people who are not opposed to getting the vaccination, but are simply not going to take any special efforts to perhaps get vaccinated. And perhaps we've heard that throughout some of the conversations, informal and formal ones. And so I think in terms of messaging tactics and looking ahead, I think that, you know, one of the ways to embrace it is that, you know, we have this closing the sale challenge, and how do we convince again those 20%? And you know, we again want to make sure that they are eligible, and they know that they're eligible, and ultimately we just need to do more active messaging to reach them. And a little bit more about messaging, I think that's important to note, is that Hispanic New Yorkers are highly concerned about safety of the vaccine, and disproportionately think that the vaccine is dangerous compared with the general population. So again, it does need to speak to areas that we can broadly message more on the lack of trust in the vaccine and how we can increase that. And a lot of some of the, you know, we can see here that about 90% of unvaccinated Hispanic, Latinx New Yorkers live in urban areas. So we know that we need to continue to amplify all these channels, digital, TV, all the airwaves, to make sure that we're getting these messages. And so I think that, you know, we need to think about, again, together, collectively, and how do we continue to motivate Hispanic New Yorkers. And the top drivers seem to be that, again, the safety and efficacy is key to highlight, the return to work, school, pre-pandemic lifestyle, and that the fact that the vaccine is free. And ultimately, you know, the increased targeted outreach that we've been talking about, so that we can increase that demand generation and meeting people where they are. So is it through the mobile vaccination efforts? Is it through downsizing these mass sites to more targeted community sites? You know, we have done 24/7 vaccination sites, continue to do those. Another thing is that Hispanic New Yorkers value expert opinions on vaccine safety, meaning that, and this is, again, I've personal experience, is families, relatives want to hear from the doctor versus the daughter of the uncle who works in nonprofits, for example. But, you know, I think that it's important to note that Latinos do value expert opinions on vaccine safety, and that the most cited vaccine information sources are local health department websites and the CDC website. So we continue to work with them at the local health department and CDC, of course. Another major thing we know, and looking forward and how to engage our communities, is local news and social media. You know, these are important news sources for Hispanics and Latinos across the state and across the country. So continuing to work with them. Again, here, just again, wanted to highlight some other key messaging and looking forward. I want to provide you all with our vaccination hotline. But of course, if anyone has any specific questions or wants to get in touch with us, I also wanted to make sure that we provided you with our COVID-19 vaccine equity at health.ny.gov email. With that, I'll close. Thank you so much.
Thank you so much, Julissa, for your presentation and the work that you're doing to increase vaccine equity and access for Latinx communities and other vulnerable, underserved communities throughout New York State, and the barriers to consider when we're engaging them. And thanks to both of our speakers for taking the time to join us today and sharing this vital information. We have a couple of minutes left for questions. We have quite a few that have come in. So please be aware that if we cannot get to your question, that I will be sharing them with the presenters. I'm going to actually take a moment to kind of combine two questions that came in to both of you that are very similar. And that's related to addressing fear and possible misconceptions or beliefs related to the vaccine, and especially religious beliefs when it comes to Latino communities. So that's to both of you as presenters, if you want to take a minute each to answer.
Okay, I will start. As I mentioned in the presentation, we need to involve religious organizations and faith-based organizations, so we can provide pastors, priests, and everybody involved with the right information. They can transfer that to congregations. I think it's easier for people to hear from their pastor or the priest and hear from us, for example, in terms of religious beliefs. I think most of the times I heard it before, what they're talking about when they say religious beliefs is that they think that the COVID-19 vaccines, especially Moderna and Pfizer, have been using fetal cells from abortions, which it has been already addressed by the Organization for Catholic Churches in the States. Even the Pope talk about it. So you can refer people to those things, those publications, so they can learn about it. I find it very difficult to convince somebody against what they already believe. The only thing we can do is constantly repeat the right information with facts and with where we get information from, like CDC or a clinical study, or something that can prove what we're saying. In terms of fears, well, it depends on fear to what, right? It's the vaccine risks, fear to go get vaccinated because what's going to happen to me there. The same, we need to continue informing and make sure that people understand that the vaccines are safe and secure, but also we make understand that the entire process is also secure for them.
Thank you, Luis. Julissa, what do you think about that when it comes to addressing fear and maybe possible myths or misconceptions, and some of them that might be related to religious beliefs?
Yeah, I mean, it's a super valid question, and one, like Luis said, that it's difficult to convince someone sometimes, but you just have to keep trying. And I think that we have creatively, innovatively as well, created campaigns to work with religious lay leaders and inform them. We've done a roll up your sleeves campaign where we connected with houses of worship. And people do cite churches and temples and mosques and any place of worship as safe places, but not everyone goes to there's that spiritual place, or and so I think that our goal is to ensure that we are at least providing folks with the information and they can make an informed decision. And remember, our herd immunity, 80%, depending on who you ask and what they feel comfortable with, but we still have a long way to go, but I think that slowly but surely we're chipping away at it. But it is very important to work with religious leaders through these efforts. I mean, when the Pope came out, and clarified and shared his opinion, I mean, again, I heard that in my household. I heard that in my mom's house. Ay, el Papa dijo esto. It's like, yes, mommy, sí, hasta even him, wherever he's at.
Even the Pope, yes, absolutely. And I think what you're both sharing with us is that one, it's important to kind of consider multi-pronged approaches as we're trying to engage our communities. And two, that hesitation can come in many forms. There may be hesitation that's more about just needing more information to make an informed decision and having more access and increasing awareness, while some may really be due to like dispelling misconceptions. And the third might be due to another factor, which is related to either distrust of an institution, possibly due to your immigration status or concerns about ICE or the police. I'm going to ask one more question, and then I think that's all we'll have time for. So this came in from Dulce Ramirez, and she's actually asking about, and this is open to both of you as well, if you all think that there's possibly discrimination for Latinos that they experience when they're trying to access the vaccine.
So I think it could be a subjective, but experience, right? But we want to, if that is happening to our community, to my community, we need to know. So I think that first and foremost, people need to understand that you can call us, you can reach out to us, reach out to Luis, who can get in touch with Julissa. And if there is an experience where someone is being discriminated at a vaccination site, whether it be a pop-up, whether it be a pharmacy, right? I mean, again, things are changing now. Eligibility and access is much more available now through pharmacies, for example. We're going to go next to primary, private physicians next. So I personally have not heard of direct experiences, but I think that, there is credit to that, I think, based on, just again, 400 years of, racial inequities in this country. And much, other newfound fears for some communities. And so I think that that is why we have to be conscious of the operations, so does it make sense to have the local police department outside of a vaccination site? No, maybe not, but maybe we can have a conversation with those who are planning it and operationalizing it so that we get ahead of that. Or, we're talking and directly creating, a relationship with a religious leader where their congregate feels, feels assured that there's somebody there, it's a safe place. So it just, again, I don't think personally, but I could understand. I think that there's also validity around, making sure that, in the clinical trials, there was Latino representation, that there's BIPOC representation. So I think that at every level, yes, it's important that we question it, but let's make sure that we're also, raising the experiences. If there's anecdotal information, that's important so that, us as a state, as the policymakers can address it head on.
Thanks so much, Julissa. Luis, do you have any thoughts on this?
Well, I completely agree with what she said. I can add, maybe there's no specific discrimination when you go to the vaccinating center, but I think we live in a society that is based on structural racism. So the fact that we don't have access, or that the center is far, or there is no transportation together, is based on that fact that the society is already structurally racist. We need to come back, fight against this. We need to make the changes. So eventually, the access is going to be for everybody, not specifically for COVID-19 vaccines, but for everything in health related. And that's what we're working constantly with the Department of Health and city and the state. Also, I think to avoid this type of possible discriminations, I see the people that should be working in these vaccination centers in the area where Latinos live and work should also be Latinos. It makes it easier for the people to get vaccinated and see them represented with the nurses and the people who register them and provide the services. I think every service that we do access.
Absolutely. And I think that's a really great way to end this session, because that's really how we can ensure health equity, and really that health equity is for all. So on that note, I do want to thank both Julissa and Luis and all of you for joining us today for our conversation. Thank you so much and have a great afternoon. Bye-bye, everyone.
Bye-bye. Thank you very much.